During the next part of our training, we're going to cover the staff section of the ACE application. The staff section of ACE has a lot of information. It's not just therapists, it's all staff, therapists, contractors, interns, and administrative staff. It defaults to show active staff members. You may actually use the same forms to track pending applicants. This can be really helpful when doing recruitment. The pending applicant can either become an active employee or an inactive applicant, depending on if they're hired. To add a new staff record, click the Add New button. A staff record is divided into tabs. The Summary tab gives us a summary of the staff member. Electronic signatures are based upon the employee name, credentials, and license number that we list in ACE. Data entry is important. Remember, good data in equals good data out. That signature is going to appear on every piece of signed documentation by the staff member. We want to make sure that that data is accurate. Physical and mailing addresses may be entered for the staff member. Emails, social security numbers, and date of births are also entered. The first 4 letters of the staff member's last name and the last 4 digits of their social security number are their default password for the application. Additionally, we identify what type of contract the staff member has so that we can know the manner in which they're paid. Next, we identify if the staff member requires documentation review. We can also indicate if they are a device user or a user that logs directly on to remote desktop services with an internet connection to utilize the ACE application. While on the Summary tab of a staff record, we can also see a button to See Therapist Schedule. This button allows us to view the schedule for the staff member. Here's an example of a therapist schedule. The user can navigate the schedule using the day, week, and month views. The schedule can also be printed in a full week 7-day view. The Credentials tab of a staff record has license numbers, SEY dates, certification dates, and a number of other dates. This data is used for reports. We'll talk more about tracking credentials in just a little bit. At the bottom of this Credentials tab, we can also see that we have an area for tracking what credentials were sent where and when. The Caseload tab has a number of sub-tabs that provide information about a therapist's experience and certifications. It also can associate them with particular CDSAs, home health agencies, and facilities. It also shows what languages they speak and zip codes that they serve. Back in the referrals, do you remember the therapist suggestion button? This is how the program knows what to suggest. We tell them what therapist is associated with what CDSA or what facilities that they serve. Really, what makes your database the most powerful is having complete data sets. The Materials tab helps us to track any materials checked in or out to this particular staff member. This includes tablets, laptops, audiometers, manuals, tests, etc. We'll talk more about tracking materials later as well. Here we can see the Payroll Setup tab. We have CFY rates and CCC rates. We pay per visit, per evaluation, but some people we pay salary. Additionally, for providers that can bill for audiology, CBRS, PT, and OT, the CPT codes box may be utilized to indicate a rate for a specific CPT service. Keep in mind that any updates to this payroll information will update the database automatically. If you do not want someone's pay to, say, increase until a specific date, you'll need to wait until payroll has been finalized before making any changes to this tab. The Billing Provider Information tab contains all the information related to the staff member as a billing provider. It shows when correspondence was sent to different funding sources and by whom. On the Notes tab, users can find information such as when an employee will be returning from leave, when resignations are submitted, and when they're effective. This is not a personnel record. This is simply meant to be informative. The Reports tab on a staff member record reveals reports that are specific to the staff member. Only admin members have the ability to view payroll reports. This tab may be helpful if, as an administrative user, you want to see the last time a person synced, for example. Here we're looking at an example of a staff report. This is a discharged patients with effective outcomes and their length of treatment report. So here we're looking at a particular staff member and we're really asking ACE, during the date range of January 1st, 2018 to December 31st, 2018, how many of this therapist patients had effective outcomes? When we look at the report, we can see that it tells us that there were a total of 8. Now, how many months of treatment and how many actual visits did these patients require on average for effective outcomes? We can actually see with this staff member, she averages 5 months of treatment and 23.5 visits. The report also displays the original diagnosis codes for the patient. Here we're looking at a report for discharged patients, reason for discharge details. This report looks at all of the patients that this staff member discharged in the date range, and then groups them according to the reason that they were discharged. This is an example of a visit attendance report for this staff member. For the 2017 year, she delivered 2,054 visits, and she missed 490, or 19.26%. The report will also let us know who was responsible for those missed visits. Was it the patient, the therapist, or other, such as funding or weather? The Payroll Adjustments tab is used for making adjustments to pay for services that have already been provided and documented. For example, if a clinician ignored the warning that they had exceeded their number of authorized visits and documented a service, an administrative user can make an adjustment of pay for the staff member. Payroll adjustments can be made at any point, and they will simply be finalized with the next payroll. The Services Provided tab displays all of the facility services that the staff member has billed for a given month. Now that we've covered the staff section, let's go in a little more detail about certain tasks related to staff members. We're going to start with staff credential tracking. Staff credential tracking begins by opening a staff record and clicking on the Credentials tab. On this tab, all appropriate dates have been filled in, and this is where the program will track to determine if dates are expiring. Let's look a little bit more closely at some of the specific fields on this tab. When ASHA documentation is received, the user should enter the effective date, through date, appropriate comments, and the ASHA maintenance period information if available. When a staff member receives their license or temporary license letter, the user may enter the appropriate date tracking. Health exam expiration dates may be entered here. TB expiration dates can also be entered here if necessary. Auto insurance and driver's license expiration dates should also be entered into the system. Any time that credentials are sent out, a user may enter a note regarding the date, where the credentials were sent, what was sent, and applicable notes. This may be done by clicking the Add Record button at the bottom of the tab. On the Credentials tab, date fields will be color coordinated. Red equals that the credential is expired. Yellow equals that the credential is expiring in 30 days or less. And blue equals that the credential is expiring in 60 days or less. The best way to track credentials is by means of a staff report. To locate staff reports, navigate to the search form for staff members, and then click the Staff Reports button. Here you will need to locate the Credentials Tracking by Therapist report. The report can be pulled by clicking on the report name, selecting All Therapists, and clicking the Run Report button. The user may utilize this report to follow up with appropriate staff members who have credentials that are expiring. The report also displays the color coding system for expiration dates. Next, we're going to discuss how to process payroll within the ACE application. Anytime a document is signed for a billable service, the clinician will be paid for the service. If for some reason the clinician should not be paid for the service, a payroll adjustment may be made. This can be done by navigating to the particular staff record and clicking on the Payroll Adjustments tab. Next, the user will click the Add Record button. The payroll adjustment form will default to today's date, but the date is editable. The user may enter the adjustment amount, select either a patient or a facility from the drop-down menus, and enter appropriate notes. Notes will also appear on the clinician's payroll summary. When the adjustment is complete, click the Return button. Once all payroll adjustments have been made, the user may continue the payroll process. This can be started by going to the Staff section of ACE and clicking the button for Staff Reports. Next, the user should locate the report called Payroll Summary-Finalize. Enter the finalize date. The finalize date is the last day of the payroll period. For example, if your staff is paid monthly, this date would be the last day of the month that you are paying your staff for. If your staff is paid bi-weekly, the finalized date would be the last day of the bi-weekly pay period. Next, click the Run Report button. ACE may take some time to generate the pages of the payroll summary. Once all pages load in the viewer, the user may choose to save the document. This may be helpful in trying to preview the document to check for accuracy. Clicking the Save button will save the document as a PDF so that the user may review the document for any potential issues. If any areas of concern are noted, these need to be corrected prior to finalizing the payroll, since a finalized payroll cannot be reversed. If adjustments need to be made, the user may utilize the Payroll Adjustments tab on the specific staff record. Once a review of the payroll summaries are complete, the user may click the Finalize Payments button. As an important note, please wait several minutes, sometimes between 5 and 10 minutes, for the program to finalize the payments. The program is literally finalizing and checking every single charge for every single clinician. It may appear that nothing is happening, but wait. Do not leave and do not close the program until you receive the confirmation that payments have been created. If you leave and repeat the finalized payment step while the program is still working, it may create duplicate payments. Once payments are finalized, no other payroll information may be added for that pay period. Payments will instead be added to the next pay period. After the user receives the pop-up confirmation regarding the finalized payments, they can click OK and then close this form utilizing the Close button. Once the payroll finalization form is closed, the user will be returned to the Reports form. The user should then click the report for Payroll Summary Finalized Totals. Ensure that the same finalized date is entered and click Run Report. ACE will generate a report that identifies the finalized gross wages for each staff member. The user may utilize this report for entering wage information into whatever system is used for payroll and may process payroll appropriately. Okay, now that we've covered payroll, let's take a moment to look at some of the staff reports that are available within ACE. The user may begin by selecting the desired report and completing the form left to right, top to bottom, including the date range, and finally clicking the Run Report button. Here is an example of Discharged Patients Reason for Discharge graph report for the selected therapist. This shows the reason for discharge percentages. This is an example of the Visit Attendance Totals report, and it shows for all staff members for the month of September 2018. It shows how many visits were delivered and missed. If the missed percentage is more than 20, it appears in red. Additionally, the report shows how many missed visits were the responsibility of the patient, the therapist, or other, such as funding or weather. This is the Discharged Patients Effective Outcomes by Therapist report. These were patients that were discharged within the date range with effective outcomes. We can see the months of treatment, total visits, and even the average age at discharge. The report is sorted by clinician name. This concludes the instructions related to staff and credential tracking in the administrative portal of ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written Administrative ACE manual for detailed instructions and screenshots related to specific features and tasks.